Garlic. For thousands of years, it's been celebrated as one of nature's greatest healing gifts. Ancient civilizations wrote about it, modern science confirms it, and you probably have it sitting in your kitchen right now. But here's the surprising truth. The same garlic that can help protect your heart, boost your immune system, and fight off infections, can also harm you, even fatally, if you make just a handful of common mistakes. That's right, 6 mistakes, to be exact. And here is the scary part. Most people over the age of 60 are unknowingly making at least one of them. These mistakes can quietly stress your liver, dangerously thin your blood, cancel out the benefits of certain medications, and in extreme cases, put your life at risk. In fact, recent research has shown that one of these mistakes alone can reduce the effectiveness of a heart medication by more than 50%. That's not an old wives' tale. That's proven science. And if you think, well, that won't happen to me, just wait until you hear mistake number 2. It's one that can slowly harm your brain without you realizing it. So in today's video on Health 365 Day, we're pulling back the curtain on these 6 little-known garlic mistakes. This is the kind of information you want to hear from big pharmaceutical companies, because when used properly, garlic can actually replace or reduce the need for multiple medications. But when used the wrong way, it's a silent threat. Before we dive in, let me ask you 2 quick questions. 1. Have you ever had an unexpected reaction after eating garlic? 2. What's your favorite way to prepare it? Drop your answers in the comments. We read every single one. And Dr. Mark Turner and our team reply with personalized tips to help you get the most health benefits safely. Alright, let's start with the least harmful mistake and work our way up to the one that could literally be fatal. Mistake number 6. Storing garlic the wrong way. This might seem harmless, but storing garlic incorrectly, especially in oil, can turn dangerous. When you chop fresh garlic and submerge it in oil at room temperature, you create the perfect home for a bacteria called Clostridium botulinum. This is the same bacteria responsible for botulism, a rare but potentially deadly type of food poisoning. Here, it's risky. This bacteria thrives in environments with no oxygen, exactly like garlic submerged in oil. A study published in the Journal of Food Protection looked at 48 botulism cases linked to homemade garlic. The findings: storing garlic at room temperature for just 48 hours increased toxin production by a staggering 400%. The worst part, botulinum toxin has no smell and no taste. You won't know it's there until symptoms hit. And when they do, they start subtly, maybe blurred vision or a dry mouth. But within 12 to 36 hours, the toxin can cause paralysis, starting from your face and moving downward. Without urgent medical help, this can lead to respiratory failure. In nearly a quarter of documented cases, patients had to be put on a ventilator to survive. The fix: if you want garlic-infused oil, keep it in the fridge and use it within a week. Cold temperatures slow bacterial growth dramatically. Or better yet, make small fresh batches as needed. Commercial garlic oils are safe because they use preservatives or acids like citric acid to prevent bacterial growth. You can even add a bit of lemon juice to your homemade oil to make it inhospitable for bacteria. For a safer and tastier alternative, try this. Roast whole garlic cloves in olive oil at 300 degrees Fahrenheit, about 150 degrees Celsius, for 45 minutes. Strain the oil and refrigerate it immediately. Roasting not only kills harmful bacteria, but also creates a sweeter, more complex garlic flavor. Mistake number 5. Mixing garlic with diabetes medications. This mistake affects millions of people living with diabetes, and many don't even realize they're at risk. Garlic naturally helps lower blood sugar, which is great for some, but not if you're already taking medications like metformin or insulin. Researchers at the National Institute of Diabetes in India studied 146 type 2 diabetics who took garlic supplements alongside their prescribed meds. The result: nearly 1/3 experienced dangerously low blood sugar episodes, below 50 milligrams, DL9. People had to be hospitalized. The active compound in garlic, allicin, increases insulin sensitivity and helps cells absorb glucose more efficiently. That's normally good news, but when combined with medication, it can push your blood sugar too low, too fast, leading to confusion, fainting, seizures, or worse. Dr. Mark Turner recalls a case of a patient who ate 4 raw cloves every morning while on metformin. One night, his blood sugar crashed to 38 milligrams DL while he was sleeping. His wife found him unconscious, and only an emergency glucose injection saved his life. The fix: if you have diabetes, don't give up garlic entirely, just use it wisely. Eat it with meals, never on an empty stomach, to slow absorption. Start with 1 clove a day, and track your blood sugar closely for a couple of weeks. And most importantly, tell your doctor you're adding garlic, so they can adjust your medication if needed. Cooked garlic is also a safer option because heat reduces allicin content by about 40%, while keeping most other benefits intact. Mistake number 4. Eating raw garlic on an empty stomach. Some people swear by eating raw garlic first thing in the morning for immunity, but if you have ulcers, gastritis, or inflammatory bowel issues, this can be a disaster. The same sulfur compounds that make garlic medicinal can also be highly irritating to sensitive digestive tissue. In one study at Seoul National University, 42% of patients with stomach ulcers who ate raw garlic experienced severe bleeding. Nearly 1 in 5 needed blood transfusions. Dr. Mark Turner explains that allicin boosts stomach acid production and can damage the protective mucus layer of the stomach, making existing ulcers worse, sometimes even causing them to perforate. That's a surgical emergency. The irritation isn't limited to the stomach. People with Crohn's disease or ulcerative colitis may also experience severe flare-ups. One patient in remission for 2 years ended up hospitalized with intestinal bleeding just 5 days after starting a raw garlic regimen. The fix: if you have digestive issues, avoid raw garlic on an empty stomach. Always eat it with food, ideally something soothing like yogurt or milk, which can buffer acidity. Lightly cooking garlic can cut irritating compounds by 60% while keeping most of its benefits. Aged garlic extract is another option. The aging process transforms harsh compounds into gentler forms while still delivering heart health benefits. Mistake number 3. Eating garlic before surgery. This one is a serious red flag, and yet it's something most people have no idea about. Garlic is a potent natural blood thinner. That means if you eat it before surgery, it can cause excessive bleeding that's difficult, sometimes impossible, for doctors to control. We're not just talking about major surgeries either. Even dental work, biopsies, or minor outpatient procedures can turn risky. A large study in the New England Journal of Medicine reviewed 4,832 surgical cases where patients had dangerous bleeding during surgery. Of those, 8.7% were linked directly to garlic consumption in the week before their procedure. Patients who ate more than 2 cloves daily had bleeding times increase by up to 250%. That means their blood took more than twice as long to clot. Dr. Mark Turner recalls a chilling case. A patient came in for a routine gallbladder removal. Pre-op blood tests looked fine, but once surgery started, they couldn't stop the bleeding. Hours later, they discovered the patient had been taking a concentrated garlic supplement, the equivalent of 15 cloves a day. Here's why this happens. Garlic stops platelets from clumping together, an essential step in blood clotting. It also blocks thromboxane synthesis, which is critical for your body's ability to form clots. These effects can last up to a full week after your last dose. Combine garlic with other blood thinners, like aspirin, fish oil, or vitamin E, and the risk skyrockets. One patient nearly bled to death during a simple tooth extraction because she was taking all 4. The fix: if you have any surgery scheduled, even something minor, stop all garlic supplements and heavy garlic consumption at least 10 days before the procedure. Tell every member of your healthcare team about your garlic use. If it's an emergency surgery, let them know immediately so they can prepare extra clotting agents and blood transfusions if needed. Mistake number 2. Eating massive amounts of raw garlic. Social media trends can be dangerous, and this one is a prime example. There's a growing fad of eating entire bulbs of raw garlic in one sitting for detox or immune boosting. But high doses of raw garlic can cause chemical burns, destroy red blood cells, and damage internal organs. Stanford University Medical Center tracked 67 cases of garlic toxicity in just 2 years. These patients typically ate between 15 to 30 cloves a day, thinking more was better. The results were alarming. 23 patients developed chemical burns in their esophagus, some so severe they needed surgery. 11 developed a dangerous condition called hemolytic anemia, where garlic's compounds destroy red blood cells faster than the body can replace them. Dr. Mark Turner explains that in high doses, allicin becomes a strong oxidizing agent, It literally breaks apart red blood cells, causing symptoms like extreme fatigue, dark urine, and dangerously low hemoglobin levels. One severe case involved a fitness influencer who promoted eating 25 raw cloves daily. Within a week, she collapsed at the gym. Her hemoglobin dropped from a healthy 14 grams DL to a life-threatening 5 GD. She needed 4 blood transfusions and 5 days in intensive care. The esophageal burns are equally serious. Endoscopy images show raw garlic in high amounts can cause ulceration and bleeding similar to acid burns. One patient's throat scars were so bad she could only drink liquids for 6 months. The fix: the safe upper limit for raw garlic is about 4 cloves a day for adults, and that's if you spread them throughout the day with meals. The ideal therapeutic dose for health benefits is just 1 to 2 cloves daily. Anything beyond that isn't just unnecessary, it's dangerous. Mistake number 1: mixing garlic with blood-thinning medications. This is the most dangerous garlic mistake of all, and it's responsible for multiple documented deaths. If you take blood-thinning medications like warfarin, clopidogrel, or newer drugs such as opixabayine, combining them with medicinal amounts of garlic can lead to fatal bleeding. The American Journal of Hematology analyzed 312 cases of severe bleeding in patients taking both garlic and prescription anticoagulants. Among these, 71 cases were brain hemorrhages, and more than a third of those patients died. Dr. Mark Turner shares the story of a 62-year-old man on warfarin for atrial fibrillation. He began taking garlic supplements without telling his doctor. His blood's clotting time INR jumped from a safe 2.5 to a dangerous 8.3. One night, he suffered a brain bleed in his sleep and died before reaching the hospital. Here's the problem: garlic doesn't just add to the blood-thinning effect, it multiplies it. It blocks certain liver enzymes, cytochrome P450, that metabolize these drugs, making their levels in the blood climb rapidly. At the same time, garlic's own antiplatelet compounds create a double hit to your clotting system. Even small amounts can be risky. One woman on clopidogrel lost vision in one eye after a retinal hemorrhage, triggered by eating less than 2 cloves worth of garlic bread at a restaurant. The fix: if you're on any prescription blood thinner, avoid medicinal doses of garlic. This means supplements, raw garlic, or concentrated garlic extracts. A little garlic in cooking is usually fine, but keep it consistent. Sudden changes in garlic intake can alter drug metabolism and throw your INR levels off balance. Always discuss your garlic use with your doctor so they can monitor your clotting time and adjust your medication if necessary. Using garlic safely for maximum benefits. After hearing about those 6 dangerous mistakes, you might be wondering, is garlic still worth it? The short answer is yes. When used correctly, garlic is still one of the most powerful natural medicines we have. The key is preparation, dosage, and timing. Let us start with something almost nobody talks about, and yet it is the secret to unlocking garlic's full healing potential. When you crush or chop garlic, an enzyme called allinase goes to work. It converts a compound called alliin into allicin, the main active ingredient responsible for garlic's medicinal power. But here's the crucial part: this process takes time. The 10-minute rule: if you eat or cook garlic immediately after chopping it, you're missing out on a huge amount of allicin. Research from Penn State University shows that letting chopped garlic sit for exactly 10 minutes before using it increases allicin levels by nearly 1,900%. That's almost 20 times more potent than using it right away. Temperature matters. Raw garlic has the highest allicin levels, but as we've seen, it can be too harsh for some people's digestive systems. The sweet spot is gentle heating, around 140 degrees Fahrenheit, 60 degrees Celsius, for no more than 15 minutes. This preserves about 82% of the allicin, while making it easier on the stomach. In a study of over 3,700 people, garlic prepared this way gave the same cardiovascular benefits as raw garlic, but without the side effects. Timing your garlic intake. For maximum absorption, eat garlic with your largest meal of the day, preferably one that includes healthy fats like olive oil, avocado, or nuts. That's because some of garlic's beneficial compounds are fat-soluble, and healthy fats can boost absorption by around 45%. Avoid taking garlic supplements on an empty stomach or right before bed. This can increase the risk of acid reflux and digestive irritation. The ideal dose: multiple studies agree. The optimal daily dose for adults is around 4 grams of fresh garlic, roughly 1 large clove. This provides about 5 to 6 milligrams of allicin, enough to meaningfully lower blood pressure and cholesterol without pushing into dangerous territory. A meta-analysis of 29 clinical studies found that this dose lowered systolic blood pressure by an average of 8.4 mmHg, comparable to some prescription medications, but without their long list of side effects. A powerful preparation method. Here's one of Dr. Mark Turner's favorite ways to get garlic's full benefits safely. 1. Crush 1 large clove of garlic. 2. Let it rest for 10 minutes to maximize allicin formation. 3. Mix it with 1 tablespoon of extra virgin olive oil and a pinch of sea salt. 4. Spread it on whole grain bread and warm it gently in a toaster oven. The olive oil not only improves absorption, but also helps protect your stomach lining. Plus, the gentle warming takes the edge off raw garlic's sharpness, while keeping most of its active compounds intact. Alternatives for sensitive stomachs. If fresh garlic bothers your digestion, aged garlic extract is an excellent option. It's made by aging garlic for up to 20 months, which transforms the harsher compounds into gentler, more stable ones like acetylcysteine. Studies show that 600 milligrams of aged garlic extract can deliver similar cardiovascular benefits to fresh garlic, with virtually no digestive side effects. Another option is black garlic, garlic that's been fermented at controlled temperatures for about 3 weeks. This process doubles its antioxidant content and gives it a sweet, molasses-like flavor. Korean studies show black garlic can improve cholesterol profiles about 40% more effectively than fresh garlic. Cycling your garlic intake. Here's a tip many people miss. Your body can get used to the same dose over time, making it slightly less effective. To keep the benefits strong, consider cycling your garlic intake. For example, use fresh garlic for 2 weeks, then switch to aged garlic extract for a week. This gives your system a break while still maintaining garlic's protective effects. Proper storage. Even the best garlic loses its punch if stored incorrectly. Keep whole bulbs in a cool, dry place with good air circulation. Avoid storing whole bulbs in the fridge. The moisture can encourage mold. Once peeled or chopped, use it within 24 hours or freeze it in olive oil portions for longer storage. Final thoughts. Garlic is a potent, natural medicine, but like any medicine, it can heal or harm depending on how you use it. The 6 mistakes we covered have caused real, documented harm to thousands of people. But when you respect garlic's power, start slowly, and tailor your intake to your own health situation, the benefits far outweigh the risks. If you remember nothing else, remember this: let chopped garlic sit for 10 minutes before using. Stick to about 1 large clove a day, unless advised otherwise by your doctor. If you take medications, especially blood thinners or diabetes drugs, talk to your healthcare provider before adding garlic supplements or high doses to your diet. Your health, and possibly your life, could depend on it. Now, I'd love to hear from you. Have you ever made one of these garlic mistakes? Or do you have your own routine for using garlic that works for you? Share your story in the comments below. Dr. Mark Turner and our team read them all, and you might even help someone else avoid a serious mistake. Thanks for watching Health 365 Day, and remember, nature has powerful tools for your health, but only if you use them wisely.